and then we move to Lee, and then we move to Robbie, and then Dick, right? All right, please, join us.
So, hi all, how you doing?
Good.
This is great. So I peeked into a couple rooms. This is really good attendance. I see folks from the university, advocacy groups, policy making groups, Elders in Action, AARP. Thank you very much for coming out today. I'm going to very briefly kind of give an overview of aging and equity, refer you to our paper, talk a little bit about age-friendly cities, age-friendly Portland, and what we've been doing here. And then we're going to dig into some of the work that's been going on, whether it's in public service agencies or research and analyses that have been completed recently. We want to leave time at the end of this presentation to actually discuss opportunities to look at tools that might be available for folks. So as I get started, I want to make a quick plug for the paper that Dr. Neal and I had written this last year for the Coalition for a Livable Future. Thank the Coalition not only for their work on the Equity Atlas, but for involving us and looking at aging as a major equity issue in the region. For those of you who have been following the kind of equity conversation, aging along with race and ethnicity, disability, sexual orientation are all major issues that we need to be taking a look at, but looking at from both the needs perspective and the assets and opportunities that do exist. So if I can, yeah, that would be great. I'm going to jump to the next slide. Actually, maybe I'll just move over here. So I wanted to quickly pull a couple of definitions on equity from the region so that we can kind of understand the context of what we are discussing. Metro, our regional government, defines equity as the benefits and burdens of growth and change that they're distributed equally. And I think that this is an important thing to understand because of the variations that do exist within our region. The work that we've been doing in age-friendly Portland, which I'll talk about in a little bit, is around the city of Portland. But our region is so important and diverse, and earlier, hearing the keynote speaker, understanding the differences that exist in the environments, not only our SES kind of distribution throughout the region, but where people are living, where benefits, where opportunities, and where needs exist is critically important for older adults in particular. Dr. Lycan is going to show us some trends that are occurring in the region that are highlighting some of the differences that do exist between inner city, kind of the city of Portland versus the region. And then the city of Portland has defined equity as everybody having access to opportunities necessary to satisfy their essential needs, advance their well-being, and achieve their full potential. And I really have tried to help and visualize this by pulling a couple of images. I think many of you have heard this on the right, this phrase, a rising tide lifts all boats. Excuse my misspelling there. I chopped up this image, this cartoon earlier. I think that it's a bit of a misnomer. We don't have a boat, or our boats are not at the same level of quality as others. When we see economic growth and benefits, positive benefits in a community, not everybody is getting that benefit, that equal benefit. And so we need to understand, not from just an equality perspective, but from an equity perspective, how we need to support and in some ways implement policies and programs that can kind of benefit people who may have disadvantages. And I love the fact that we were using our eco-imagination earlier to think about ourselves in being in a different position. And maybe I encourage you to think about that from an older adult perspective, or even from a person who may have a disability from that perspective. One of the key lessons that I've learned in working in the disability advocacy community is that we're all temporarily able-bodied. And so how do we think outside of our current condition to think about our needs and the needs of our neighbors and colleagues? So I want to frame equity, sustainability, and age-friendly cities. So how many of you have heard about sustainable development and sustainability, right? Yeah. This buzzword kind of the past 10, 12 years that's really continued to define a lot of the work that we're doing. We know that the Bureau of Planning in Portland is now the Bureau of Planning and Sustainability. Sustainability is still core to the work that we're doing in equity, in resiliency, and creating cities and communities that are good for everyone. So if we think about sustainable development, it's really about allowing current generations to meet their own needs while not compromising the ability of future generations to meet their own needs. Well, if we think about that, that's a temporal relationship, right? We're looking into the future and into future demographics and age structures. What do we know about our aging age structure, our changing age structure? Are we going to be younger or older in the future?
Younger.
Markedly older, absolutely. This is a very interesting time, and I'll talk a little bit about the opportunity in a moment. But when we think about sustainable development, we understand that there are three major components. There's the economic piece, the environment piece, and the social equity piece. And today we're going to hone in a little bit on this social equity piece. And so I've broken off on the right side here these sustainability domains and the work in age-friendly cities. And I apologize for getting ahead of myself, but I'll discuss age-friendly in just a moment. So when we look at the environmental components of sustainability, we can think about the built environment, things like housing, transportation, outdoor spaces, and buildings. And I was just reading an article yesterday that was kind of looking at the aging of our population perhaps having a positive impact on our natural environment and contributing to that environmental sustainability. It's the first research I've seen that's actually touched on that. The social equity component has all sorts of implications and issues to deal with. Respect and social inclusion, understanding how people can be more participatory in their social circles, civic participation and volunteering, communication and information, how communities are supporting older adults, both from a health perspective and also the services that are provided. And on the economic side, employment is critically important. We found in our 2006 baseline research on age-friendly cities that not only were people 65 and older seeing age discrimination in the workplace, but people as young as 45 and older were also seeing that. So these are really important kind of issues. And then on the economic development side, we understand that this is an opportunity, that not only are we aging as a region, but we have things like entrepreneurial activities that are occurring at later ages at higher rates than we thought. Dr. Djurdjevic has done some work here in kind of looking at the fact that older college-educated migrants are coming to the region at higher rates than other cities. What are we doing to prepare for that? What opportunities are there? I know one of the big things that we're doing is looking at an age-friendly Portland that may be able to attract tourists in the future. Little things like that are good opportunities. So we know that we're aging in a rapid and unprecedented manner, and that our window for preparing is shrinking. The first boomer turned 65 in 2011, and we're in the midst of this aging change. I want to point out that there are many public, nonprofit, and for-profit entities that are providing programs to meet the needs of older adults. I'm going to talk about age-friendly cities in a moment, but that is not to discount the incredible work that's been going on before we started this program and that continues on. So we're going to get a chance to hear from Bobby and from Lee to talk about their programs. I just want to highlight that this is not the Institute on Aging that is implementing these programs and policies. We're part of a larger push to try and highlight these as important. But we still have inefficient attention that's being paid to the issues of aging in our region. What we hope to do in the Institute is to provide a backbone organization that can facilitate collective impact as we move forward, so that the county, that the city, all of the nonprofit partners are able to continue their work and to really come together to highlight and kind of multiply our efforts to be stronger. Just a couple things about our future. This is a personal issue for all of us, whether we're 25 or 75. We as a culture deny the fact that we're aging, and so it's important to come to that realization, whether it's us, our parents, or our neighbors. We need to be thinking about these issues because it is a personal issue. Active aging is a concept that is important to kind of keep in mind. So not only physical activity and health, but social engagement and understanding healthy environments for people to thrive and to be able to participate in a number of different ways. And we are here in the region positioned to become a leader locally, globally, nationally, internationally. We are already doing this work and moving things forward, and with the help of other agencies and you as citizens, we're able to continue to march forward. And just the last point, I urge you as much as possible to think about aging and older adults in a positive light, to not think about just the needs that exist or the declines that happen with age, but the fact that the aging of our population is actually an opportunity as we move forward. So very briefly, I want to talk to you about the Age-Friendly Cities movement. In 2006, the World Health Organization started an Age-Friendly Cities program, and Portland was the only city in the United States to be involved in that original research. As we've moved forward to become a member of the global network of age-friendly cities and communities in 2010, we're one of just a handful of cities in the world that's continued from this very initial project. In 2011, we were officially accepted into the network, the City of Portland. We had Mayor Sam Adams sign on as a partner and pledged to do an action plan for an age-friendly city and to move forward with essentially making a more age-friendly city. In 2013, the Age-Friendly Portland Advisory Committee had our action plan for an age-friendly Portland accepted unanimously by City Council, and we're now in the stage of implementing that action plan. This action plan was developed based on not only evidence and research that had been collected in the community from a number of different sources, but also from multiple stakeholder perspectives. Our advisory council is a very diverse advisory council, represented from public, private, voluntary sectors, as well as people who represent different stakeholder groups in the community, whether it's the faith-based community, various ethnic and racial groups as well. So we've worked really hard to get a very diverse set of actors to help us in moving forward. So where we are today, we're implementing our action plan. We have 3 initial areas that we focused on: housing options and policy, economic development and employment, and civic engagement and volunteering. And I have a few things that I'm actually going to leave out. I'm sorry I didn't pull them out before, but we have some very small bookmarks that have information about the Age-Friendly Portland website and projects that we're working on, including a discussion guide for getting involved with older adults, engaging in discussion with older adults in your community. I also wanted to tell you about the housing work that we're doing. So on October 28th, for people who are in the professional building industry, if you're interested in attending a meeting, breakfast forum out in Tigard, we're going to talk about opportunities and barriers to implementing the action plan. And then we're also working on economic development and employment project right now with a number of stakeholders in the community looking at employment opportunities, and then also So I'm going to leave you here. For anybody who is interested in more information, the agefriendlyportland.org website is here. You can also grab what would be a bookmark on the way out, and I will do my best to leave the flyers perhaps over on this side so people are getting water and grab those as well. Sorry to go over a little bit in time. But thank you very much, and I know that you'll gain a lot of insight from the presenters who are going to follow.
So, just in case you didn't see, Margaret got these out and they're coming around. We have more, don't worry. Drying my materials here. So. That's because I spilled the water all over the presentation. Okay, so I'm Lee Gerard, and I'm, as the slide says, I'm with Multnomah County Aging and Disability Services, and we are what's called a federally designated area agency on aging and disability. It's a federal designation, and we do a lot of different kinds of services for older adults and people with disabilities in Multnomah County, and they run a lot of gamuts, and you've probably seen some of those services. Think senior meal sites, think in-home and facility services for low-income folks that need long-term care services. But we also have some responsibilities around advocacy and planning. And so we've actually been very fortunate to be involved in the Age-Friendly Portland activities from the very beginning with Margaret and Alan and all the other folks on the advisory council. And one of the things that's really exciting for us is that we're kind of moving. The Age-Friendly Portland plan is really evolving and growing, and so we're going to be really fortunate to be working with Margaret and other folks later this month to actually do a resolution at the county level to talk about how the county is signing on to be age-friendly. And we really look at that as a way of extending the reach of that age-friendly plan and actually working with some of the other local jurisdictions in the area who are going to need some of that support to look at infrastructure and engagement and those kinds of things. So I'm not going to go into a lot of details about the numbers because we have somebody else here that is actually much more of an expert. But I do want to I wanted to show some things here as examples because one of the things that we do as an organization that's responsible for planning and advocacy is we do have to think out longer term. We need to be assessing what's going on in our community right now and how we're being positioned and how we're supporting other organizations in the community to support older adults. And then we also have responsibility to make sure we're looking out into the future. So we recently contracted with PSU to actually help us do some demographic trending out to 2025. And not too surprising on some of the information. This is just an example of some of the high points of the information that's shared with us. Big gains in 60 plus population. What a lot of people don't realize, though, is that the 85 plus population, at least for the near future, is actually declining a little bit. And the folks that deal with demographics can actually explain that in more depth than I really want to spend time on today. But the other thing is that while the percentage of older adults living below federal poverty level is going to remain fairly stable, that doesn't apply equitably across all older adults. So, and I've got a slide that kind of shows that. So that's an equity issue, that as we're looking at the numbers, we have to start thinking, okay, yeah, a lot of us as we get, and I'll be there, as we age, we'll be doing okay, but that we don't all have the same opportunity. And the numbers really show that. Also, what's happening with the trends is it's going to change the way our community looks. So how things are moving about. And for us, that's really important because we fund services, we fund different kinds of infrastructure, things like transportation, or we're part of a network that's funding those things. And if where people are living and where the equity issues are is changing, then we need to be thinking about that in advance so that we can respond to it. And then, especially in the area of older adults, we're going to be seeing some big changes in the ethnic and racial diversity of older adults in the Portland area. So, and I'm just going to share a couple of examples. These are just a couple slides. This is one I was talking about the inequities around the impact of economics for older adults, and this is a good example. You see that, whites will be doing pretty good. Hispanics, no, not so good. So, and this actually just goes out to 2017, so that's just around the corner. And then this is just one example of some mapping that we've done. It's a little hard to read because the numbers are kind of small, but this shows shifts in where people are living and where the populations. So this is really the growth rates of African American older adults, people 60 plus, in the county. And we've had a lot of infrastructure for older adults, African American older adults, in these communities, out in this area, kind of. But you look and see where the changes are happening, and you'll see that actually the growth in African American older adults, very big, mid-county area, Gresham, and actually even on the west side, and much smaller in their traditional communities. Not too surprising, we've had, I'm sure you've been in a lot of the conversations about, gentrification and things like that. But it's not just, it's really a full family unit, and that includes the older adults. So thinking about those kinds of numbers as examples of things that are challenges and things that we need to be addressing. So these are just some examples of challenges that we're thinking about. One is our workforce. We need to have a workforce that reflects the people that we serve. And so and we also need to have a workforce that's responsive to a wide array of diversity of the people that we serve. So we're really we've been thinking and working on this for a long time. We start from the ground up in Multnomah County. We look at things like what kind of MQs, minimum qualifications, do we put out there when we're hiring people? Because that can be a barrier for people even applying for our jobs. When we do an interview process, do we have an interview process that allows people that come from a wide variety of backgrounds to be able to express and share with us transferable skills, and so that we can get in the best kinds of folks into our organization? And then once they're in our organization, are we making sure that we're supporting everybody, that we support older adults who are working for us, that we support people across generations? We definitely have a cross-generational workforce, that we're supportive of people that may have come from a different cultural background, that has a different perspective on how you communicate around conflict, or just a wide variety of things. And then our employees at all levels able to think about and address issues. A very good example is that we've been working on making sure that our workforce really understands the issues of older adults who are from the LGBT community. And it was very interesting, the evolutionary process that we've gone through with that. We thought, okay, we're gonna, and this just goes to show, the other thing that I think is really important is you need to have flexibility and humility when you're doing these kinds of activities. So an example for us is that there's this great video out that's called Gen Silent that really highlights the challenges, the trauma, and the issues that the current older adult population that's LGBT have experienced over their lifetimes. And you know, we go out, we're gonna do good things. So we start showing the video. It was very obvious that we needed to step back and do some work internally. Just showing a video, number one, people went away very upset, but they didn't have an opportunity for action. And they quickly told us that. And then so we decided, okay, we're gonna have some dialogue, we're gonna have discussions. Well, people that are leading those dialogues, whether it's talking about LGBT issues, cultural issues, or I'm a person with a disability that's had lots of barriers, facilitators, supervisors, staff need to have the skills to have a conversation that can be supportive and not end up being a harmful conversation. So we've actually done some work within our organization to give staff the tools to have those conversations. Otherwise, you'll end up with conflict situations that don't end up leading to resolutions. So those are kind of workforce types of issues that we're dealing with. The other thing, when you saw the map, a challenge that we have is we fund services based on certain kinds of criteria. One of those is funding formulas. We have a funding formula that we utilize that looks at things like the number of people 60 plus, the number of people 85 plus in the community, the number of people below federal poverty level, the number of people who are ethnic and racial minorities. So you've got this issue of money following the person versus maintaining community infrastructure. And that's a big conversation we're having right now. It's probably going to be a foundation of some community planning we're going to be doing the next year or so. Because that map that you saw showed that there's there's going to be a big growth in ethnic and racial minority older adults out in places like Mid-County and East County. And so we really do need to move our funding out into those communities to support the service and the infrastructure in those communities. However, and this is kind of, we're always in our organization talking about both and. It's both this and it's this. Those communities don't just stay in that community, those individuals. They still have networks in those old communities that they have moved from. So Northeast is a good example. They still need transportation to go back to go to their church. They still have family members that live in those other communities. If we just wholesale take funding and move it to another community, that's going to leave some big gaps. And it's challenging figuring out how do you do this and how do you do it the right way. Can't say that we have figured out the right way to do it yet, but the important thing is for us to identify it and start talking about it. And that actually leads to kind of the other part of this is really engaging the communities, because the point is we don't have the right answers. You know, sometimes it's an issue of we're the mainstream organization, we're the county, we're the government, and how do we basically have the people that we're hoping to serve, how do we have them direct and guide the services that we're going to be providing? How do we have conversations to really have folks be able to say to us in a safe way, you know, you guys are saying that you know you're bringing these services to us, and really this is not what we need. So how do we get communities engaged in those conversations? And that's where maybe talking about some of the tools is kind of helpful. At the county, we have a county-wide effort using an equity and empowerment lens, and I put the you can go there and find it. It's actually, if you're trying to find it on our website, it's under the Office of Diversity and Equity. And that's really, you know, that's become infused throughout our whole organization. It actually started in our health department. And it's a tool that was actually lifted, plagiarized from other communities, you know, steal other people's good work. But I would have to say that the Multnomah County Health Department did a really good job of infusing another component to it that was not necessarily as strong in some other communities, and it was the empowerment component. You know, looking at the fact that it's really, you know, whether you're doing the work within an organization with your staff, that you have to empower staff at all levels. If you're working out in a community, you really want the community leading and guiding the work. You know, with folks like the county or whether whoever's doing that, helping to provide some of the resources for the conversation. So we use that as kind of our guiding principle and tool, and we really do try to infuse it through whatever we do. We even do things like apply it to, as we're doing reporting, apply a couple of components of the equity lens to how we report out to the community. And kind of the things that we're focusing on in our reports. Are we really thinking about all of the community as we do reporting? Stuff like that. We do have, our division has a multi-ethnic action committee that we utilize to help us lead our efforts. And then we do a lot of community planning and engagement. We went through a process about 3 years ago of really engaging the community because we started seeing some of these numbers. We looked at, we went out and worked with the community doing stakeholder interviews, focus group and feedback sessions. We had an innovations work group that was really community members that helped us look at our service structure. And we really realized that we weren't really following some of the tenets of the equity lens where putting your money where your mouth is, so to speak, with how we allocate resources. We had a lot of funding going to large mainstream organizations in this community. We had almost no funding going to organizations that were really identified and recognized by a wide variety of diverse communities. So we really have changed a lot of our service structure based on the input of an innovations work group that we had, and have really beefed up resources that actually it's the local communities that tell us what they want, and then we end up contracting for the services that they basically tell us they want to do. And that's actually a lot more responsive. So I do think we have a lot more work to do. I'm pretty excited about what is happening in some other areas of our community around looking at trauma-informed care and research that's actually directed and run by the community themselves. And I actually think that's the kind of thing that we can be doing more of in our division. So, but I'm going to stop now because we've got a couple other presenters.
Hi everyone, I'm Bobby Weinstock. I work at Northwest Pilot Project, and that's a small social service agency just 4 blocks from here at Broadway and Clay. and we serve older adults in Multnomah County. By older, I mean 55 and over, and we focus on addressing the housing needs of older adults in the county. We provide direct housing services to 1,500 older adults in Multnomah County each year. So in terms of focusing on the vulnerability of older adults in this community, I'm going to focus today on vulnerability that is caused by having a very low income. There's all kinds of other reasons that older adults are vulnerable in this community, disability, and other kinds of things. But I'm going to focus exclusively today just on what happens when you have very low income and you're a senior in this community in terms of your housing situation. Just an example of the kind of calls we're getting where I work. Last week, 62-year-old caller has lived out in East County for many, many years. Apartment building sold, rent raised from $600 to $800. The caller only had $1,200 a month in Social Security income, and very desperate, panicky kind of call, because how am I going to address this rent increase and still meet all my other essential needs? Rent burdens, which are escalating so rapidly in this community because of the real estate market and the way rents are drawing up very quickly. I can't overestimate the amount of desperation and stress these increasing rent burdens are causing for older adults in this community. Just our small agency, and we only have 14 employees, we're getting 100 calls a week from older adults in Multnomah County who are asking for help with their rent. They're asking for help finding a more affordable apartment. And it's not a quick solution to try to address their need. To give you an example of what the problem is, we could go to the slide that shows the income levels of the older adults that we're seeing at our agency. And you'll get an idea of the very small monthly income. The next slide. So you can see the problem right away. The monthly incomes that people are trying to survive on are simply too little to meet rent, and to meet food, and to meet health costs, and to meet transportation, and to meet all the other essential needs. And there's thousands of people. I'm not sure if the public at large is aware. There's thousands of older adults trying to live at these income levels. And in a nutshell, that's one of the biggest drivers of desperation and stress and even homelessness in this community. Lots of the calls we get aren't just from people who have an apartment, but we're getting calls from people who have lost their apartment and are now doubled up with friends and relatives, or in the worst case scenarios, they're now homeless. And a lot of it is driven by these very inadequate income levels, given what rents are in this community. Remember, the federal government defines an affordable place to live as consuming no more than 30% of your income. And you can see what 30% of people's incomes would be on the far right-hand corner of that chart. There are no apartments in the private market that rent for those rent levels anymore. And thus, this is kind of the kernel of the problem. Let's go to the next slide. So, in terms of what housing inventory we have in the city and the county, and what people's incomes are and what they can afford, I think the key statistic to look at here, and I'm focusing on the most extremely low income group, the 0 to 30% of median income group. 30% for a single person of median income is $14,600 a year. So we're talking about households that have less than that in income. You can see in Portland that there's a shortage for that lowest income group of almost 19,000 apartments. that would be affordable to them. And for the county, there's a shortage of almost 22,000 apartments that would be affordable for the lowest income group. This is an underestimate of the problem because, as you can see, this data is from 2010. And it doesn't even take into account the rapidly escalating real estate values that have occurred in this community over the last 4 years. So when people ask me, why do we have homelessness in this community, this is usually the chart that I show them. We simply don't have enough affordable apartments for our poorest citizens. And this isn't just for seniors, this affects all low-income people. But certainly seniors who don't have an easy way of raising their income up are even more adversely impacted by escalating rents. So we do have some apartment buildings in this community that are affordable for folks at the lowest income levels. Those are called our subsidized apartments. Typically, these are apartments that have federal rent subsidies attached to them that flow through the Department of Housing and Urban Development. And people with the lowest incomes only have to pay 30% of their income if they're lucky enough to get into one of those apartment buildings. The problem is the waiting list for those apartment buildings has become huge. So when someone calls and says, I can't afford my apartment anymore, I'm 62, I just got a $200 a month rent increase, we can give out a list of the subsidized apartment buildings, but we have to tell the person they're going to be waiting a year or 2 or 3, depending on which apartment building they're going to go for. So it's not going to be an immediate solution to their problem. So let me move towards what are some of the solutions that people are working on, both locally and federally, to try to address this incredible affordable housing crisis that we're experiencing. Yes?
Can I ask a quick question before you move on?
Yeah.
Have you looked at this table by disaggregating the data and to see what extent the burden is disproportionate across race and ethnicity? Because this is just low income, but what percentage of low income African Americans, Hispanic residents, white non-Hispanic?
I mean, I have not, but that would be something that should be done, and maybe I'll consult with a data expert here to see exactly how to break it down by ethnic group. I think the information exists, and it's just a matter of reconfiguring it a different way. This I just wanted to give you an idea of what the total shortfall was for all low-income households, renter households. But there's a lot of different ways this could be broken down.
I think the coalition of communities of color.
That's what I was going to say, the unsettling profile
Yeah.
might have it because it highlights racial disparity among 28 institutions.
The coalition of communities of color, we've done a lot of that work.
Thank you.
Their website.
Other questions? Okay, so on a more hopeful note, and that's kind of the dire perspective of what the need is. So moving towards some at least partial solutions. And any solution has to either lower the rents for the lowest income people or increase the incomes of those lowest income people. I don't see any other way to address this issue. So one of the ways that this is hopefully going to be addressed on a federal level, the National Low Income Housing Coalition has a campaign called United for Homes. And they're basically working to try to get passage of legislation that would reform the way the mortgage interest tax deduction works. And if they were successful, it would free up $20 billion a year nationwide to help the lowest income homeowners and renters. So it would create a whole lot more funding for affordable housing creation across the nation, or a lot more funding for rent subsidies. So that's one of the national campaigns that hold some promise. The Oregon Opportunity Network, which is a local statewide coalition of nonprofit housing developers, They're working now on ways to develop a local housing trust fund, a sustainable and local source of resource that can be used to try to address some of these housing needs. The Meyer Memorial Trust is convening a task force of developers to try to figure out ways to lower the cost of building affordable apartments. It's very, very expensive right now to build affordable apartments. And so they're looking at innovative ways with a whole bunch of developers in the community to try to lower that cost, because if you can lower the cost of construction, theoretically, you can charge a lower rent. I don't know if folks have heard Ted Wheeler talking, the Oregon State Treasurer, but he's spearheading an idea of trying to increase the retirement incomes of Oregonians, because so many of our seniors don't have any retirement income that they built up over their life. Their jobs didn't have any kind of retirement accounts, or they didn't have jobs that had that kind of security built in for when they retire, so they're totally dependent on Social Security. So Ted Wheeler is talking about an idea where they use like a PERS type model of making sure every working Oregonian is going to end up with a retirement account when they get older, and they're going to use private market model investing, I think, in the stock market, a PERS type model, to make sure that Oregonians have a much more robust source of money to fall back on than just Social Security when they retire. I'm sure you'll hear more from Ted Wheeler about that idea, Margaret.
He's talking at City Club today, so anybody who wants to hear that presentation can hear it on OPD tonight. I think it's at 7, or you can go see the podcast.
Thank you. Good timing. Two last ideas. One is the Affordable Care Act has recognized that there is a very intimate connection between being healthy and having adequate housing. And so there's an opportunity within the Affordable Care Act for healthcare dollars to flow into making sure people have adequate and affordable and accessible housing. And so this could be a potentially new source of housing, not just the affordable apartment, but also the services that might be necessary to make sure the older adult is able to age in place. So Cedars-Sinai is an owner of some of the larger subsidized apartment buildings downtown. I know is taking the lead on looking at innovative ways of using healthcare dollars through the Affordable Care Act to kind of subsidize adequate and affordable housing that comes with services that are needed to keep people stable. And the last idea that hasn't been proposed, but I'm going to suggest it anyway because I like it, is the model they're using federally to address the needs of veterans. Serving veterans is one of the only things that Republicans and Democrats agree about in Congress. So the money to serve homeless veterans and at-risk veterans is really flowing. And one of the models to reduce the number of homeless veterans in the country is basically to give homeless veterans Section 8 vouchers, which is a direct federal rent subsidy that's going to allow them to rent in the private market and make their rent affordable, because the government is going to pay a portion of their rent. They're only going to pay 30% of their income for rent. The government's going to pay the landlord the remaining balance. And I think we need a similar program for low-income seniors in the country. If we're really going to address the housing crisis here locally and across the nation, the kind of investment that they're putting into veterans, we have to call federally for a similar kind of investment for low-income and homeless seniors across the country. Right now, only 1 out of every 4 income-eligible low-income seniors gets a federal rent subsidy. The other 3 are out of luck. So we have to look at rent subsidies for low-income seniors more like an entitlement, like food stamps or health insurance. If you're income eligible, you get it. That's not true with federal housing dollars, and I think we have to try to tweak that model nationally. Yes.
Sorry, you mentioned the Affordable Care Act. There might be some part of the legislation that allows us to use healthcare dollars to subsidize housing. Do you know more about where we can find information on that, or is Cedars-Sinai? Maybe I'm just trying to figure out where. I've studied the Affordable Care Act, and that's news, so I'm interested to know more about that.
Does anyone know what would be a good source of information? Yes.
You know, just one source right now. There's a new housing study that was published by the Harvard Joint Center of Public, Harvard Center for Joint Housing Studies, I think is what it's called. And they've got some information in there about the Affordable Care Act. And I think it's thinking into the future, not that it's a program that's easily tweaked at this point.
Okay, yeah, because I'm vaguely familiar with a study in San Francisco where, I mean, they provided housing to a lot of folks and it decreased ER utilization by 50% or something. So, I mean, obviously, that's a good better way to spend our healthcare dollars.
Yeah, there's huge possible cost savings if we can guarantee people affordable and accessible housing with the services on a site that they need. Yes.
I work at Landing with Housing Services in Corvallis. We recently acquired a 35-unit hotel, historic hotel, which is low-income housing with place-based Section 8. And you were mentioning there were places here in Portland that have similar setups where the subsidy stays with the unit. And I was just wondering if that's something that if you know, if that's still being developed and if you can still have access to those, because we have a really hard time getting that subsidy attached to units now. We can only we had to acquire that building because we hadn't, then those subsidies wouldn't disappear. And I was just wondering if that's something that maybe for some reason in Portland is more accessible than it is in Corvallis. But we developed multifamily housing that had set-asides for domestic violence survivors, and we couldn't get those, and so that you haven't been able to fill those units because that's the #1 problem for domestic violence survivors, is that they don't have income. So
We have a representative from our local housing authority
Oh,
who
perfect.
provides the subsidies.
So I'm with Home Forward, which is the housing authority in Multnomah County, and we frequently project-based Section 8 vouchers, which is difficult because we have over 20,000 people on our Section 8 wait list right now, but there are some kind of requirements around how you do that, and generally it's in partnership with a jurisdiction or something who's trying to develop specific housing. So we just recently approved a project-based contract for a project in Gresham, which deals with folks that are quadriplegic. And so a certain number of their units will have permanent subsidy on it, but it's really hard because there's just not enough to go around.
Okay.
Yeah.
Thank you. Or just maybe there was like a magic.
No, I wish.
Let me take 2 more questions, and I better stop because we will run out of time.
I'm curious, according to what you was asking, you are serving elders, you are serving adults who are age 60 plus. I'm just curious, in your serving, can you give us a number according to ethnicity or group, if you have that? Because if you can this presentation where you are talking about equity, if you can give us something you are doing for equity.
40%, we serve 1,500 older adults, 55 and over, each year in Multnomah County. 40% of the people we serve are people of color. In my briefcase, I can give you the exact breakdown, but I don't have it right here with me. But I'd be happy to give that to you at the break. Yes?
Yeah, I was wondering, there's discussion these days about tiny houses or very small houses.
Yes.
And that goes for houses for homeless. It also is manufactured housing, and there's also apartment buildings, basically 50 units or more or less of small 200 square foot apartment units. You have any information about that, and is that an option?
I think that's one of the ideas is that group of developers are looking at to try to bring down the construction costs and create a lower rent apartment. I think that is definitely on the table as one of the ideas. And there's a whole group of people just working on the tiny houses idea. Yeah. And yeah, I don't have a source to send you to, but I know there is one and I can get that for you. Okay.
Yeah, we need to wrap up now and move to the next. So we'll get additional questions at the end. So thank you very much.
Portland State working in an area of school park, providing planning support to school districts. And about a year ago, Margaret invited me to come and join the Institute on Aging to see if some of the concept and data we use in school planning could be applied looking at issues related to aging. So my talk goes further out of that. And also over the last couple of months, we've been talking about the Portland Plan and the ways in which the Portland Plan addresses issues of aging. So that's kind of formed some of my thinking over the last few weeks. So I'm going to talk about where older people live. We'll do some mapping of it, looking at concentrations and dispersed patterns, housing types and comings and goings, who's moving in and who's moving out. So here's a map of Portland. It's based on 2010 block level data from the census, and it shows where older people are found across the Portland metro area. The size of the dots proportional to the number of people aged 55 plus, and the color indicates the proportion that are 55 and older. So the green dots on here have only about under 25% that are 55 and older. The yellow dots from 25 to 49, the red dots 50 to 74, and the purple dots 75 and older. And we'll be focusing principally on the Portland area with respect to the Portland's plan here. So here's the table that shows the housing mix in the green, yellow, red, and purple areas. So in the green areas on the map, which takes in a lot of outer reaches of Portland, North Portland, 49,000 of the housing units are apartments, 64,000 are single families. There's almost an even distribution between single family owner occupied housing and apartments and condominiums. The yellow area on the map would be sort of characterized by some of the southwest Portland post-World War II housing and some of the inner east side, the Lower Hearst Grant Park pre-World War II high-quality housing, and that the housing in the yellow areas is almost 80% single-family owner-occupied housing. The red areas on the map are a transitional zone that have a mix of apartments, condominiums, and some single-family housing. And then finally, the purple areas, the largest number of housing units are what Metro classifies as retirement housing, and then also with other apartment housing. If you look at the bottom of the graph and look at the distribution of the population 65 and older, a quarter of them live in the green areas, 59% live in the yellow areas, 9.3 in the red, and 6.3 in the purple. The number that are living in the red and purple areas will increase significantly, not necessarily at these same locations, but in other areas of multifamily, multi-use zoning housing, and it's difficult to predict exactly where that might occur. But these numbers are going to grow. If you look at the household types in the green area, predominantly they're households that have nobody age 65 plus in the blue up here, and a few, one or more age 65 plus. But it takes in so much of the city. There's still a lot of older people that live in those areas. In the yellow areas, a few more age 65 plus, predominantly two-person households, and then as you move up into the red areas, you kind of get an equal mix of those that are 65 plus or not, and an increase in the number of people that are living in one-person households where the spouse has died in many cases. And then finally, in the purple areas of the map, predominantly households that have one or more people that are age 65 plus, and in a high proportion of one-person households and high proportion of the females due to the differential effects of mortality. I'll get a marker. Here's a graph that shows the population distribution for the green, yellow, red, and purple areas. This is the green area, and it shows the numbers by 5-year age cohort in 2000 and 2010. And you can see this is an area that has a lot of younger families in it, and the children tend toward the younger age range. And if you look down at the bottom of the graph, the green bars show the ages of people who are in-migrating into these areas, and they're largely younger people. And above that, you can see some green bars to the left that shows the households 35 and older where there's an out-migration that are creating the vacancies for the young people moving in. So old people are part of the housing dynamic in creating housing vacancies for younger families. Here's the yellow area in the map, and think Laurelhurst, Grant Park for this group, and you see that there's a considerably older households living there, children living there, a bit older. And if you look at who's moving in and out, you see that the predominant group moving in is the 25 to 44 age group, but there's another bump of older people in their late 50s and 60s that are also moving into some of these high-quality residential neighborhoods. And most of the vacancies are created by mortality, older people dying. And then finally, in the red areas, you see a predominantly older population, mostly 65 and older. And if you look at who's moving in, some in the 55 age range, but more of them a little bit older when they're moving into the red areas on the map. And the vacancies in these areas are created essentially wholly by the deaths of older people. So moving on, talking about housing types for older persons, comparing Portland to the metro area, the way in which age affects housing choice, married couple households, and then looking at the relatively large number of older persons that are living in multi-family housing. This is a map from the American Community Survey, and the pie charts on here show this is for the householders aged 65 and older, and the pie chart shows what kind of housing they're living in. So the liney green on this map are the proportion of householders that are living in single-family housing. Most of them do. The largest number of 65 and older live in single-family housing, and you can see large areas of the city where most of the pie chart is green, but what really kind of struck me is the number of pie charts where most of it's blue, where a high proportion of the 65 and older are living in apartment housing. And then if you look at the downtown core area, you see the bright red, which is condo housing, multi-family owner occupied housing. And so they're really kind of multiple groups of older people with respect to how they're housed in the city. So for the city of Portland, if you look at the bar graph on the bottom, the purple line on the right is the 65 and older population. So for single-family residential owner-occupied, about 58.8% of the 65 and older populations in single-family owner-occupied housing, but farther over to the right for multifamily rent, some 28% live in multifamily rental housing, and a fair number in condos, and not so many in single-family rental housing. This is the same figures for the Portland metropolitan area, and it shows that outside of Portland, a higher proportion of older people live in single-family housing, and a somewhat lower portion live in multiple-family housing. this is also out of the American Community Survey, and it's a custom table that's created from a public use micro sample, and it shows by the age of persons, the proportions that are living in different types of housing. So from age 20 to 29 up to 45 to 54, the proportions living in single-family owner-occupied housing increases, stays about steady, and then begins to drop after about age 65. At the bottom of the graph, you see some of the other kinds of housing. The solid red line is the proportion living in multifamily housing units that have more than 50 or more units in the housing complex. And you see that's the group that really begins to kick up after about 75 to 79. But, and this is for married couples, but for married couples, you can see most of them still stay on late in life in their owner-occupied single-family housing. And although there's a pickup in those living in apartments, it's not a high proportion. By contrast, if you look at older people that are in other than married couple households, a much smaller proportion of them live in single-family owner-occupied housing, the blue line on the graph, and the red line, solid red line on the bottom of the graph rises up to about 35% of the older age groups. But still, even for other than married couples, the majority of them continue on late in life living in single-family owner-occupied housing. So, you know, this is significant because at those older ages, one begins to pick up higher disability rates, which changes their needs for housing. And interestingly, the disability rates are not geographically very different between Portland and Eastern Oregon. It's a characteristic of people more than place. Well, moving to a different topic, one of the things that I looked at was the population forecast that the city had done by age and also by Metro's forecast. The city's forecasts are really Metro's forecasts that they adapted for their own use. And what I found really striking about this was the large part of the increase in population that is due to the population that's 65 and older. The red areas represent growth from 2010 to 2040. So it goes from 1990 in the light blue to 2010 in the dark blue, kind of now or recently to 2040. And if you, there's the forecast. If you look at the increase in population, this is just the increase in thousands, and look at the left-hand side of the graph over in here. The high numbers of increase occur in the fairly new future. This is 2015 to 2020 with the large increases in the 60-64 up to the 70 to 74 age groups, and then 5 years later it migrates on down into the 5-year older cohort. So it's a problem of some immediacy in terms of the effects of the demand for housing. For the Metro's forecast for the metropolitan area, almost 36% of the increase in population is in age cohorts that are 65 and older for 2015 to 2025, and for 2025 to 2035, the same figure is 38.2%. This is a large percentage of the increase in population that's due to older people, and one of the critiques one might make of the Portland plan is it pretty much seems to revolve around labor force and the young creative class that's moving to Portland, which is really kind of smaller in number in terms of the increase in numbers of older people. The same calculation for the city of Portland is about 40 to 44% of the increase by cohort is in the 65 and older cohorts. One equity issue involves income and housing affordability, which the last speaker just addressed. So I took a look at income distributions for the city of Portland for various age groups. And so, one finds for, and if you can see that on here, the black are the households that have one or more persons age 65 plus, and the red bars are the ones that don't. For married couples, there's not a large difference between the income distributions for those older households and younger households. But if you look for other than married couple households, you see there are substantially more of the not married couple households in the lower income range. So marital status, whether it's a two-person household, single-person household, has a significant effect on income. And if you look at owner occupied households, you see that the black bars at the bottom kind of stick out farther than the red bars, suggesting that amongst owner occupied households, the incomes of older people are lower. And if you look for renter occupied households, surprisingly it has kind of the opposite effect. But in rental housing, older households have slightly higher income. They're kind of farther along in station of life, and the 65 and older people living in rental housing have a bit higher income than the 20-somethings and the 30-somethings that are living in rental housing. That's a little counterintuitive, but that seems to be what the data shows. So, and here's a graph that shows the rent as a percent of income. The red bar that comes down the graph is at the 30% level. This is the age of residents, and so it suggests that there are quite a few people to the right of the bar here whose income whose housing costs are more than 30% of their income, but there's not and this is for married couple households, but there's not a clear indication that seniors are more disadvantaged. But if you look at households that are not married couples and rental households, you pick up an accumulation down here of a higher percentage of seniors that are spending more than 30% of their income as reported in the census. So the graph at the left is for not married couples, tenure related, tenure rented, and on the right, married couples, tenured rented. And on the left for the not married couples, it looks like for the oldest groups that there's a higher percentage that are cost burdened than are for younger groups. And here's the same data for ownership and for Portland City. So this graph is for other than married couples owned with a mortgage, and this is the percent of them that spend 30% or more of their income. So there's a fair number that exceed the 30% level, nearly 60% for some of the older age groups. For married couples, not so much. For those that own their home free and clear, the results are pretty mixed. There aren't so many younger people that own their homes free and clear, so the data gets a little bit thin. And finally, if you look at married couples that own their homes free and clear, that group is obviously much better off with respect to housing costs than are all of the other groups. So I was looking for something here that would tell me that older people are more disadvantaged than younger people with respect to housing costs, and there's not too much here that supports that. There's some evidence, but it's not total. So of the persons age 65 and plus living in Portland, 42.7% live in households where they own the home free and clear, 29.8% in households with a mortgage, and 27.6% in renter households. So some conclusions here. Most of Portland's older households are married couples living into the 80s. single-family housing, which they often own free and clear. People like me and my friends, most of the people that I know, but a substantial number of less well-off or older households live in apartments, often one-person households and fewer assets to cope with late-in-life housing needs. The mental forecast suggests that a large part of the growth will be persons age 65 plus, and even more so in the Portland plan. And given this increase in reading the Portland plan, it just didn't seem to me that they very adequately address the needs of older people. They tend to kind of generally address the needs by income and household size and things like that. But given that so much of this growth is for older people, it perhaps should have been more essentially addressed there. The aging of the baby boomer population results in a large demand for housing for older populations, and this effect's going to be felt pretty soon, in the next 10, 15 years, and it will be interesting to see how the private sector responds to that. The Portland Plan background housing studies and mental forecasts pay no special heed to the growth of this older population, but are mainly oriented to the workforce and younger households. The mental forecasts are largely driven by employment, and it's kind of a labor force forecast. And I've had some discussions with the people at Metro who are doing the forecast, and I'm not really persuaded that they really adequately thought through how to forecast the where in the metropolitan area for where older people will live. And then finally, in the determination of housing needs for older persons, the Portland plan should probably consider the variety of types of older households. Each has its own needs and capabilities. Taking care of the affordability issue, it wasn't a clear issue that older people were more disadvantaged, but amongst older people there were a lot of different household types for whom housing needs and problems would be different. And that finishes what I've got. So it's kind of data rich and hard to follow in a short period of time. It's kind of a lot of broccoli. You know nothing of broccoli. Can we put this up on a website if people want to?
Yeah, we can put it up
If
on
you want to be able to track through it with the
pdx.edu/IOA. We'll put it up there under research, on the research tab.
Yeah, or publications, I forget.
Publications tab.
Yeah.
Research. pdx.edu/IOA.
Sure.
Questions? Yes.
I just wanted to offer a comment on your second bullet there. Home Forward administers about 9,000 Section 8 vouchers in Multnomah County. 60% of those are held by elderly and/or disabled people. And a large, substantial number of the folks on our wait list, which is 20,000 people long, are elderly and disabled, much to Bobby's earlier point. So a lot of very low income seniors out there with no resources.
Yeah, I wanted to add one other point and see what your thoughts are on this, and that's while there might be a large percentage of elder adults in single-family houses now,
Yeah.
I would imagine we'd anticipate that will change dramatically down in the near future, because housing costs have gone up so dramatically that those who probably aren't housing are ones who bought when they were more affordable. And so is that something that anybody's kind of taking into account, because our next generations of elder adults might not have as well
The turnover of housing, that people get older and move on, is part of a natural process. It sometimes kind of the gentrification in Portland, a lot of people in the inner east side sort of cashed in on they had equity in their homes, and housing prices rose, and people moved out of the inner east side areas somewhat younger than you'd think, and those areas turned over. But I also have some concern about the Portland plan, the identification of the centers, neighborhood centers, regional centers, and what's going to happen in the areas that surround those in terms of housing conversion. It no doubt will result in densification and loss of single-family housing in those areas. A good bit of that single-family housing is occupied by older people. They may leave somewhat sooner. Maybe they'll be incentivized by bought out and leave sooner. But I'm not sure where the older people are going to go. The Metro's housing survey, recent housing survey, pointed out that overwhelmingly most families prefer single-family housing, and older households, perhaps more than other families, prefer to stay on in their single-family housing. And the Metro forecasts also show that within Portland, most of the new housing that's going to be built is multiple family housing. And so, there's kind of a mismatch there between housing preferences in general and what Metro says the housing mix is going to look like in the future. And that may be exacerbated with respect to older households in terms of the choices they have. So it may well be that in the future not so many will live in single family housing, maybe not out of choice, but because of the opportunities that are presented to them.
So I was just gonna say that Metro survey, I thought it was slightly skewed because 65% of the respondents already lived in single-family homes.
Yeah.
And they were saying that their preference was that. I wish there had been a more outreach around people who don't have that opportunity or that were lower income.
Now, the published survey did have very little in terms of the preference of older households.
Yeah.
I don't know if the sample was too small to address that question or not, but it didn't come out in the reports in the survey that I read. So.
Questions for the other panelists also at this point. This is our opportunity. So. Yeah.
The question goes to Yi. Mike Noma is waiting on how to pick it up. But the question here, you mentioned that there is a movement between people moving the original area they were living to another area. And my question here is, if Mike Noma has a study where they know that because people are moving, and to make solution we needed to know the causes of why people are moving. And if people are moving because of those causes, what is the preference? What is the solution you are making in place to make sure that the people are not moving or people are kept where they can be and safe?
Yeah. So what are the causes of people moving? And is there anything that we can do to help people stay where they want to stay? That is a huge question. And I think we can be part of the conversation about that. I don't know that I would say that we would have an answer about how to deal with that issue. I think some of it is around some of the issues around affordable housing. I think that's a big one. And I can actually say that from a personal experience that I just had today, where we're actually helping somebody move out of the county because they could not find an affordable apartment in Multnomah County. So we actually had to help them move to another county, which is not what we want to be doing. So I can tell you I don't have a good answer for it. But I do think that if we can, at least we as a service agency can be thinking about ways that we can support people maintaining those networks in those communities where they've typically been from, that can at least help people consider the fact that maybe they, even if they have to move, that they can still maintain that network and that commitment and connection to that area. I do not think that's a good solution though. So the other thing is, how do we then, if they're having to move to another area, how can we make sure that that is a great community for them to live in? That's the other thing that we can try to do. And it's very frustrating for me because I don't think, if you're going out to Mid-County and East County, as far as age-friendly, I think that there's some big challenges. It's hard to walk, it's not safe, and I'm talking about, whether you're a kid or a 75-year-old. So I think that there's some big issues.
I just wanted to add the Portland Bureau of Transportation, and so we hear from people that what they need to age in place is to have just what you were just saying, safe way to walk to the bus, Safeway will walk to light rail, and for us, the biggest opportunity on that in the next 6 weeks is waiting at the table out there in the hallway, ourstreetspdx.com, where there's an opportunity to create transportation funding, where safety and maintenance are the priorities, and we need your voices in the next month at City Council, email City Council members about what you think the safety priorities should be.
This lovely gentleman over here. Mustache.
That's the first, though.
That's Andy Cotugno. He works for Oregon Metro. That's the regional government encompassing the urban portions of the Tri-County Portland metropolitan area. Andy has 40 years of professional experience in the transportation and land use planning fields. He received a bachelor's degree in city and regional planning from California Polytechnic State University, San Luis Obispo, California, in 1974, before I was born. And has done graduate work in public administration at Lewis and Clark College in Portland. Andy has worked at Metro since 1980, when he was appointed as, okay, my apologies, 79, when he was appointed as transportation director. In 2008, he was appointed to the position of senior policy advisor to the Metro Council and chief operating officer. He has a really big brain. And then we've got here Duncan Bong, who grew up in a Taiwanese American household in rural Upper Michigan. He has a Bachelor of Arts in Political Science and Asian Studies from the University of Michigan and a JD from Lewis and Clark Law School. After becoming an attorney, he relocated to Asia. I'm not sure where in Asia. Beijing. Fantastic. And get this, to practice international corporate law, where he advised Fortune 500 companies on their cross-border merger and acquisition activities. Sounds dangerous. However, in searching for more socially conscious work, he returned to Portland. He currently serves as the Development and Communications Director for APANA, the Asian Pacific American Network of Oregon. And I'd like to ask Elaine to introduce me.
Kari is the Pacific Northwest Regional Policy Manager for Safe Routes to School National Partnership, where she works to increase funding opportunities and improve transportation policies that support safe walking and bicycling for children and families in the Portland metro region. She has worked in the U.S., Australia, Copenhagen, in the intersecting fields of active transportation, health, environment, and safety for more than 10 years. She has a master's degree in environment and community from Antioch University in Seattle.
So we're set up in what's called an open fishbowl style of conversation. We've got 6 chairs, but only 5 of them are filled. And as I said, it's not because we're waiting for somebody else who's going to come and present. It's because that chair is for you when you want to participate in the conversation. So thank you, Andy. So I'd like to invite anyone from the audience to come down at any point and join the conversation. The only rule is that when somebody else comes and wants to also join, you have to give up your seat. So you can finish your sentence or answer your question, but then you need to give it up to the next person. So everyone can participate.
Yeah.
Only in that new seat. Sorry. And everybody can hear okay. If anybody needs to scoot in closer, please feel comfortable to do so. So we're here to talk about transportation funding in the region. More importantly, we're here to talk about how we as a region get to a place where transportation funding and decisions benefit the communities in our region that are most in need of transportation improvements, such as sidewalks, crosswalks, access to transit, schools, and other community destinations. Right now, and maybe you've heard this already today in one of the other sessions, but people living in low-income communities in this region are almost 2.5 times more likely to be killed while walking across the street or even on a sidewalk. That's pretty unacceptable, and it's a direct result of how we have historically built our transportation system. I want to touch on the significance of healthy, active transportation in the region, the huge importance of safety in our transportation system, and how we can build our transportation networks to work for people of all ages and abilities through meaningful involvement of the communities that are most in need. So some of the questions, how do people in our communities really, what do they need to get around safely and easily to the places that they need to go? And who is working on getting this done equitably and quickly, most importantly? So I've talked about the fishbowl. I've got a few sort of directed questions for each of these folks sitting here. But I'd like to invite anybody, as I say, to come and sit down, and if I'm asking a question of Andy, anyone else here at the table to also answer and participate. I really want this to be a discussion. So, as Elaine said, I work at the Safe Routes to School National Partnership. I work here in the Northwest as an advocate. I know, because I have 2 little kids, that the best way to start a kid's day is by getting some activity. Turns out that exercise in the morning helps kids learn more and behave better all day. There's a lot of other benefits, as a lot of us in the room know, to leaving the car in the garage or the driveway or on the street and getting to work, or kids working and biking to school. But what I work on is the fact that the number of kids walking and biking to school in 1969 was about 50%, and today nationwide is about 13%, which is not acceptable. 20 to 30% of morning traffic congestion is caused by parents driving their kids to school. And there's a better way, of course. But what we know is that kids who walk their bike to school are 30% more likely to walk their bike to the library, to their friend's house, to the park, to other places, and do other things. Kids who walk and bike to school starting by 1st grade are more likely to stay healthy and active and keep a healthy weight during their early school years. And walking and biking to school can give kids up to half of their daily recommended exercise, which is about 60 minutes a day. And our kids, as probably everyone knows by now, are not getting that exercise. Our kids are, more than 2/3 of them are overweight or obese in this country. And it's really shocking how little they're actually able to move. But we're talking about the region, we're talking about all the people in the region, all communities, all people of ages and abilities, so you can replace the word child with commuter, or wheelchair user, or car-free family, or older adults. The benefit is the same, which is that we need our walking and bicycling networks, because where they exist, they benefit all the road users, and unfortunately in our region, they're not yet complete. So there are these programs that exist. The Safe Routes to School program that I work with is an established program that's been tested, and it helps make routes and destinations safe, helps to educate and encourage our kids to walk and bike to and from school, and they're extremely successful. We've seen drops of school morning drop-offs go in half, from 800 to 400 drop-offs in some places. We've seen huge increases. I know Gabe will talk about the city of Portland. Has had an 8-year commitment to the Safe Routes to School program, and they've seen a 13% increase year after year after year that's held steady. But unfortunately, in a lot of the parts of our region, those programs don't exist. The necessary infrastructure to actually make those places safe for all of our kids, they're not funded. We don't have the funding for that. We haven't prioritized the funding for that to reach all the kids in the metro region. So it's sort of disheartening to know that something as simple as walking to school is just not an option for a lot of our kids in the region. But it doesn't mean that it's not happening. A lot of our kids in the region are actually walking to school, even though it's unsafe. Even though too many communities are lacking sidewalks and bikeways and crosswalks that would benefit those kids and everyone else in the communities. So I think that, all that's just to say that we have the opportunity to prioritize our kids and to start doing that, because I don't think it has to be that way. And I want to just, before I jump into the questions, I want to just say that if you agree with what I'm saying, that we should be able to prioritize our kids and help make them healthier through our transportation system, and build our system so that it works for everybody, starting with our kids and moving all the way up to everyone in our community. I'm going to pass around just a sign-in sheet, and if you want to sign in to that, I'd be happy to get in touch and provide more information in the future. So I will do that, and then I'll start asking questions. Thanks. So Gabe, there's questions for you. Gabe works at the City of Portland, and the City of Portland wants to improve safety in the city, of course, and has put forward a proposal to fund transportation safety and maintenance projects through a user fee. The city has also talked about Vision Zero as a goal that they're working toward, but lately we've been hearing that some people in Portland don't see the value of investing in safety. They only want to see the city spending money on maintaining streets. So what I'd like to hear from you is if you can explain a little bit about how safety plays into the transportation system and why transportation funding should include a significant portion for safety projects.
Sure.
Thanks.
Happy to. So let me start by trying to address our streets funding effort and this sort of tension between safety and maintenance, and then maybe we can get to Vision Zero a little bit later on. For folks who are not familiar with our transportation funding effort, and I can see several people in the room who are our mayor, State Commissioner Steve Novick, have been working for the last year, I'd say, on identifying a new revenue source to fund critical transportation needs in the city. And it's this proposal is being shaped as we speak. It goes to council on November 12th, so it's a good time to be involved if you're interested in transportation safety. And one of the issues that's still being this is still a live issue is the split between how much you invest in, how much of the new revenue is invested in maintenance and in paving, and how much of it invested in safety improvements. So we have some stakeholders on our various committees advocating for a 50-50 split, 50 for safety, 50 for maintenance, and some, as Kari alluded to, advocating for more of a focus on paving maintenance, maybe a 2/3 in that chunk. In my role at the Transportation Bureau, I manage our safety programs like High Crash and Safe Routes to School, as Kari mentioned. So from my perspective, I'd love to see as much money for transportation safety as possible. I really see the need to invest in making our streets safer for all Portlanders. But I, just to pick a little bit at the tension, there are folks in the business community, folks in our Freight Advisory Committee, who are concerned about paving and paving maintenance and the smoothness of our streets, but they've also been some of our strongest safety advocates over time. So it's sort of a mixed bag. When we do our work right as a Transportation Bureau, when we're doing a maintenance project, it has safety benefits, and vice versa. When we're touching a street to make a new improved crossing, hopefully we're also maintaining the assets when we're out there. So there's a lot of overlap between what we consider maintenance work and what we consider safety work. Again, it's a live conversation. You can talk to some of the other folks in the room about the argument that these are projects that we really need to be investing in. I think as a Transportation Bureau, we've done a really good job of articulating the benefits of investing in preventative maintenance of our roadways. So the value in doing fog sealing or crack seal on roadways before they deteriorate and become much more expensive to fully rebuild. I think folks in our business community get that construct, and they want to see the city benefit from that, those long-term cost savings. Where we haven't maybe done such a good job is in articulating the long-term costs of traffic injuries and fatality, and how broadly borne those costs are by our community. So, we were talking earlier about different ways to calculate those costs. The National Safety Council pegs the cost of traffic fatalities and injuries at $150 million a year for Portland alone. So those costs include things like lost work, lost productivity, insurance costs, travel delays, congestion due to crashes, medical costs. When we have long-term maintenance costs, those fall back on the city and back on the Transportation Bureau where I work. When we have these traffic fatalities and injuries, those costs don't necessarily come back to our bureau. They're spread across the community as a whole. They're often spread toward our most vulnerable, and folks in our business community are the ones who are, in many cases, footing the bill for the insurance or the medical or the congestion delay in delivering their goods. So I think in the next, hopefully we're better able to articulate what the value is for safety and why investing in the safety projects will make our transportation system stronger and our economy and our community sort of more prosperous. Sorry, should I talk about Vision Zero too, or come back to that? So,
anybody want to join us?
Seat at the table.
Anybody have any questions for Gabe?
I have a very specific question. I think it's specific, and I get to talk first. I can't come up here and just listen unless it's after I've said something.
You're the first
The
to get to
idea of
make
sitting
the
in
rules.
that chair is to talk.
You gotta get to pay the fiddler. I wonder how people working in your realm, and the people thinking about it, deal with the issue of this game of cashing out, or penciling out the societal cost of an unnecessary debt.
Mhm.
How do you justify that? It looks to me like the rationale ought to be no debt, any debt is a major problem with regard to the traffic we're having to get around and do the things we want to do. It's not excusable, really, in any way. And the idea of customarily accepting, calculating in terms of dollars is just plain crazy.
Well, that's a good segue, because you're, it touches on this concept of Vision Zero, which is a traffic safety framework that was developed in Sweden and more closer to home in New York and San Francisco are cities that are adopting this idea that every traffic fatality is a failure of government. It's our transportation systems, rather than calculating out, what's the safety savings over some period of time, which we have formulas to do. We're going to treat each fatality as a civic failure, and how we and approach designing a transportation system that puts safety at the top priority, so that we can work toward having a system where nobody is struck and killed crossing the street to get to school or to get a cup of coffee. Yeah, it's a significant problem. It's a high priority for our transportation director, so it's something that we're working on. Last year in Portland, we had 36 traffic fatalities, so it's more than double the number of homicides that we saw in the city. If we're successful in this Vision Zero effort, part of it is going to be that culture change, which you clearly already are there, where when you wake up and you're listening to the radio, you hear TV, you're listening to TV, and you're hearing about traffic delays on Outer Powell because of a crash. You're not thinking about it in terms of your commute time, but as a loss of a community member in the city. There's sort of a culture of acceptance where there's just a certain number of people who die every year on our roadways, and there's nothing we can do about it. So that sort of paradigm is something we need to change, so that people are more willing to make certain trade-offs to put the livelihood and safety of everybody.
You can sit there as long as you want, or you can go back.
It's a little bit like that old-fashioned technique of dance for people with tap
Oh,
the
tap you on
shoulder.
your shoulder, and then you have a new dance partner.
Yes,
I think that was good.
And
Sorry, that's
you, the female part, wouldn't have any choices. Who it was.
Unless it was Sadie Hawkins.
It was an agreement amongst the males.
I'm John Buck, I live in Southwest, I'm somewhat involved in most of you. I don't know. But, first of all, I got 2 points. One, safety. If we don't pay for safety, it affects all of us. We get a lot more parents driving their cars this way and affect congestion. And then when there are accidents, it slows everything down to a stop, and we then have to go back and as a society have guilt about, we should fix that intersection and so on. So, it really does affect us all in a major way. So I personally feel the 50-50 split is very reasonable, and we have a hard time supporting something going beyond that.
With the street fee you're talking about.
I'm talking about the street fee. On the issue of debt, I've read that almost everyone in this room has a debt on the house. Now, 100 years ago, debt on a house wasn't even possible, so you had to accumulate the amount of money to pay for the house almost out of pocket. So very few people could afford to buy houses. And so, our industry has flourished because we financed it. On debt on public facilities, if we take bridges, Barber bridges were built, almost 100 years ago, 80 years ago. $120,000 for 2 Barber bridges that today are costing about 12 to 15 million to replace. That, or more probably, but that kind of thing, if we're going to enjoy the benefits by having debt, we enjoy them now and pay them out over time as they're used. And to me, that makes a lot of sense with things. I understand the concern about both the magnitude of debt and particularly people repaying their college loans, but in the long run, they make decisions because they want to get ahead and they view that as a positive thing. I view debt as a very positive thing for the cities and municipalities responsibly to finance important issues. The thing that would bother me is frivolous debt, and there's some that Petra's done, I think, frivolous, but that's another argument. The key thing is those facilities now are important.
Okay.
I think that works for capital improvements. It doesn't work for maintenance.
Exactly.
You don't buy groceries on debt. You buy your house.
Not if you're sensitive.
Right. But there's also limits. You can't buy 2 houses or 3 houses if you can't afford to make those payments. So there's a share of your income that makes sense for debt. ODOT, Oregon Department of Transportation, spends 25% of their budget on debt. So they're probably about maxed out on what's reasonable, especially given that the lion's share of the rest of their budget does have to go to maintenance. And if they were to do more debt, then they're just robbing maintenance.
Okay, so I want to just touch on a little bit about what Gabe said with regards to Outer Powell. I'm talking about East Portland and the statistic that I brought up earlier, which is that our low-income communities in our region suffer traffic fatalities. People crossing the street and getting hit by a car at a rate that is almost 2.5 times greater than in the better off parts of the region. So this question is for you, Duncan. So it's known that many areas in East Portland have not benefited from the investment in basic infrastructure such as sidewalks and crosswalks. East Portland also suffers the highest fatality rates, with the vast majority of pedestrians struck and killed by automobiles in Portland on streets east of 82nd Avenue. Yeah, not a coincidence. Your organization, Apano, does quite a bit of work in East Portland's Jade District, and the community has had to suffer a lot of those preventable pedestrian deaths. So when we're talking about this transportation funding, the user fee or other projects that are going on, how do you bring your community's voice to the table, and why is this an issue that your organization looks at all?
Yeah. I guess first of all, I just want to ask the audience, how many people here have heard about the Jade District? Raise your hand.
The what district?
The Jade.
Jade.
Jade District.
Little festivals there.
Yeah.
Legislative festivals, yeah.
So that was actually a pretty good majority, which means we're doing something right. Because a year ago, no one heard of it. So first of all, I just want to set the stage for our work. As our work in the Jade District. This is the area around Southeast 82nd Avenue and Division. So it's kind of like where PCC Southeast is and where Kuban is. So this area is the most diverse area in the county. So we have the most diverse census tract. It's the only minority census tract in the whole county. So it's just a really diverse place. It's got a lot of young people. It's got a lot of old people. So a lot of people of color, young and old. We're pretty much the most at risk for traffic fatalities. And it's also an economically challenged area. Our local school is 88% free and reduced lunch. So it's just it's a difficult place. And we have people that are most at risk. And indeed, this past February, we actually had a traffic fatality on 82nd Division in 85th. It was a community elder that really had our community really hard. So just from kind of that setting the stage, that's why our organization is a group that manages the Jade District, which is a urban renewal area for the city. We're really concerned about safety because it impacts our community every day. So what are we doing about it? I think kind of going on, why we're working on it. Earlier this summer, we did a community visioning process. It was done by Vietnamese, Chinese, English, and Russian. These are all independent workshops, and the #1 priority of every community was walkability and safety. Everyone knows that walkability and safety is the #1 issue, and that's really what's kind of informing our work out in East Portland is the community wants it. It's it's really, you know, impacting the people that we work with and really care about. So that's our number one priority. So what we're doing about it, you know, we really believe in community organizing and leadership development. And actually, I just want to recognize Stanley Moy here. He was our former Jake District organizer. So he really actually helped us and continues to really make relationships with the local business owners and Chinese community. So for us, you know, developing a connected community and getting these various different groups to work together on taking collective action is really critical. And I think that's probably the only way we can get stuff done. You know, we're not going to raise enough money from big sales or foundations to fix our traffic safety issues. We know that, you know, we have to work with government and, you know, metro and planning authorities and everyone, bring everyone together at the table to really talk about this issue, get something done. So we're really focused on, you know, building that local power, doing community organizing, and doing like leadership development. So bringing the people that are most impacted by these issues to places of power to talk about these issues. You know, so we've done just, you know, the community visioning. We do a lot of canvassing. So this was summer, we knocked on doors throughout the district, and you know, I think this issue was just super important. Someone told me that you know, they don't feel safe watching or having their kids walk home from a bus stop, so they actually drive to a bus stop, you know, to drop their kids off at the bus. So you know, I think that's a, you know, pretty big deal. And our school doesn't have sidewalks across the street, so parents just don't feel safe letting their kids walk to school, which Gary mentioned. So I think that's a real big issue. You know, so what we're really looking to do throughout this whole process is to create win-win situations. Like we have this community vision that everyone really believes in. Here's what the community wants. And I think there's also the government side of things, and then with work with developers and landowners. So it's really bringing people together and finding out how we can develop these win-win situations where we can actually get stuff done. So you know, it's been a great ride so far. We're working with Kiba. We just did a transportation safety training for 100 Chinese elders this week. You know, they were so happy someone came in and talked to them in Cantonese and talked about traffic safety, and this is all possible because of, you know, a grant from Kiba. You know, so I think there's just, you know, bringing together the different stakeholders that really care about, you know, making things better for our community, finding out how we can create all-around wins. So that's been our work so far.
Great. Councilor Harrington, did you have a question for Duncan? If not, I wanted to do a follow-up. But
I'm happy to jump in now if you want.
Go for it.
Some of what I've been hearing, and it was also highlighted in the question that you asked.
Speak up, please.
Sure, I'll try. From what I was hearing and from what I heard Kari ask of Duncan, really touched on sidewalks and crosswalks and safety and walkability. And I hope you'll have fun with this, a little bit of a role play in a way. Often as an elected official, am I the only one in the room? Okay, so I'll represent all of us bad elected officials. How's that? I often hear a false dichotomy between my back to people.
Why don't you go on the other side?
I often hear a false dichotomy. People or community, and we've heard this word used at this table, versus business and the economy. So, how dare you take transportation funding and invest in sidewalks and crosswalks for people in the community, because, you know, those things aren't going to increase jobs or help me in my business make money. And I'm wondering if the table would be willing to talk about that and what kind of arguments do you have for that false dichotomy that I am role-playing?
I think one thing that we were really concerned about in the street fee is kind of the equitable distribution of benefits. You know, I think people in East Portland and people of color and underserved communities I think when there's things like a street fee that, you know, place an economic burden on all of us, but we see the benefit going to, you know, downtown, or, you know, we're not getting sidewalks, you know, other people are getting sidewalks first before we go. I think that's, for us, a lot of the issue is, you know, I see that we're gonna get charged more money, but we don't see the benefit, or we do, it'll be 10 years from now. So I think that's one of the big concerns of, you know, I think our community, and, you know, it is a financial burden for our business owners. So I think it's really, you know, how do we have a fair distribution of benefits and burdens? And so far, I haven't really seen that in that fashion. I think the city and county are getting better, but I think we still
Can you speak up, please?
We have a lot of room to make up for, I guess, in that respect.
And to get to your point about economics, I think there are a lot of ways to talk about the economic benefit of investing in active transportation. We can talk about how much congestion costs us, and we can talk about how much our healthcare costs us, both through fatalities and injuries from traffic crashes, but also just the cost of healthcare because we're overweight and obese and not getting enough activity. We've got heart disease and diabetes and all of these community things that we don't necessarily see when we walk down the street, but we see as a region in the cost. And that costs business through absenteeism, that costs everyone through congestion, premiums. You know, I think what I said at the beginning, 20 to 30% of morning traffic congestion is from parents dropping their kids off to school. Something like a third of that, the parents actually go back home then. They're not even going on, it's not even trip chaining to go on further. So that kind of congestion does cost us. It costs businesses because their employees are sitting in traffic. You know, there's also, we're not really going to talk about this, but we can't not talk about climate smart. You know, the cost to our climate because of too many people choosing to drive in a car by themselves is huge, and that's a cost that we haven't been calculating. And I think that you're absolutely right. It's something we need to bring better together, and it's possible, but we just don't do it often enough. So that's a great reminder.
Also, safety is bigger than safe routes to schools. You know, just substitute safe route to work.
Mm-hmm.
You want your worker to make it to work today? Or vision zero. Is that the one death that's acceptable? Is your worker not making it to work? I don't think so.
These kind of expressions do help.
Yeah.
We need to hear more of them.
There's a video that on YouTube that I recommend you check out that Nevada and both Minnesota have done for both these Vision Zero goals, programs, and in both cases, I think Minnesota stole it from Nevada, but in both cases they're sort of interviewing people on the street, sort of, how many people do you think die on Nevada roadways every year? And you know, they get 6 estimates from folks at the fair. And they say, well, how many people do you think should be dying? What do you think our goal should be? And then, you know, the first one, they're like, well, I don't know, 10,000, like 70, you know, they're all over the mountain. They're like, well, I don't know, maybe 100 would be a reasonable goal, maybe 200 a year. How many people do you think the goal should be for in your family? Well, 0. So I think we just need to make safety a little bit more personal for people in a way, and that's sort of that, it's that culture change where it's not just about the crash on the morning commute, it's about somebody's life who's been destroyed and the ripple effect that has through our community. Not to scare people out from like getting out of their house, but to just care more and be willing to make those investments.
I just have a comment for you. The economic. But I have a different comment for the chair. Okay. I was just on 82nd Avenue actually recently in terms of economics and sidewalks. I looked at it sucked actually, and not at 82nd Avenue. I love 82nd Avenue, but I was like, you know, the packed dirt kind of in a hill, and then it go down into like this gaping gap hole, and then a little patch of sidewalk, and then some gravel and some house. Anyway, so I think safety and economic, if you go, for example, to the Pearl, there's really nice wide sidewalks and they're filled with people walking and spending money. There's really great restaurants, shops, businesses along 82nd Avenue. very interesting, very rich. There's so much life on that stretch of street and in that neighborhood. And it's really hard to walk from business to business. So, you know, if you're gonna choose to go out for a nice stroll of shopping, you might choose somewhere where there's a streetcar, there's a wide sidewalk, and there's lots of bike parking, and there's bike lanes, and there's, you know, lots of, so it's easy to go shopping. So, anyway, that was not my comment that was the table, but I think there's a really strong economic argument. One of the themes I've been hearing today is that we need to change things institutionally and at a systemic level. And so just to get your comments on, recently the California state legislature passed a new law saying we are not going to measure when we want to spend money on a project to improve safety or make the road better. We're not going to first measure, well, how does this money that we're going to spend impact the level of service we're driving? Nope, that's not the law anymore. We're not going to do that. We're now going to say how much more vehicle miles traveled is this project going to make. And if it's more, we don't want it because we have to impact climate change and safety for people walking and biking and driving and taking transit. And so there's some very strong institutionalized things that guide every person working on how money is spent and how projects are built, from your engineer to your, you know, whole across the pulse on that type of systemic change that could, because right now it takes Apano and St. Francis School to go out and advocate and beg and, you know, sort of say, no, the project should be this way, and really fight for it. And it's a lot of energy, and a lot of citizens don't always have that time. I think Joanne recently said that. Everyone has time to read hundreds and hundreds of reports and kind of track things so that they can go out and sort of, you know, beg and argue for a road or to be built a different way. Because right now the system is sort of pushing for roads to be one way. And we've actually got laws in place, we call it V over C here in Oregon, not level of service. So just curious to hear your comments on that.
Can we fix them?
Well, I don't know, I mean, that's, how do you fix it, or just?
One thing I've heard and people have talked about is, you know, when you do big projects like that, you often have to go get like environmental impact assessment, do the health impact assessment, maybe there's all these different kind of assessments you have to do. I think equity should be one of those assessments. You know, there should be an equity assessment you have to do when you do a big project. And that should include community engagement. It should have funding for community engagement. And you should go out and talk to people and see what they really want and need. I think I see it sometimes, and I think, you know, Metro's done a good job on the Powell Division project of doing community engagement. But other times, the government entities don't. So I think, you know, every time public funds are expended, I think that equity lens should be, or ought to be applied as well.
You know, you talked about climate change, and I think the interesting thing with climate change and transportation is, you know, the cost that we pay for transportation, the cost of fuel at the pump, doesn't capture the full cost. It's that negative externality concept that there's impacts that you're not paying for that everybody else bears for climate change. And the same, I think, is true for transportation safety. We just talk about it less, which is that, you know, the cost of driving at 50 miles an hour on Outer Powell. You're not paying the full cost when you consider traffic crashes and injuries and fatalities. So it's work, because our system is not set up to capture to make the people, you know, to ascribe the cost at the beginning, at the pump, or at the choice for the person who's making the choice about how to travel and get around. So we need to have other tools to capture those costs, and it's going to be more work because, you know, our
Your concern about using the wrong metrics is getting worse, not better. The feds are right in the middle of a process right now mandating that all metropolitan areas establish, and states establish metrics for the performance of their transportation system, and they mandated minimum metrics around congestion, accidents, bridge condition, pavement condition, and then other things you might want to measure. But if everybody measures those, and only a few places measure broader outcomes, then the whole federal system gets institutionalized around those kind of measures. And there's broader, it's the externalities you're talking about. There's broader outcomes that we're seeking out of our investing in transportation than just those things. So, for example, Congressman Blumenauer has introduced legislation, hasn't gone anywhere, because knowledge does go anywhere in Congress, to make sure that at least with the accidents, crashes, that it includes pedestrian fatalities and injuries, not just auto-related fatalities and injuries. Just that simple adjustment is important. But we've argued that while those might be some of the measures, they're not all the measures, and we ought to be measuring broader outcomes that are important to the community. That's going to reform how the feds operate. And so we're at kind of a pivotal place right now. We can reform it for the better or the worse.
Great. I'm going to scoot us on to the next question that I've got for Elaine. Hello, Mr. Moore.
Mark.
You get to ask him hard questions.
Yeah. So we all want a healthier transportation system that isn't dependent on private vehicle travel. We might not all actually want that, but the vast majority of people would like to not be 100% dependent on private vehicle travel. As we know, transportation is vital to older adults' mobility, quality of life, and particularly independence. Our population is aging. It's happening all over the world, actually. I did a lot of work on this when I lived in Australia, and it was a huge issue that the government was actually taking up, how to manage the ability to drive and whether you let people drive and providing the resources to let people get around through that specific lens. So as our population ages, we need to ensure that older adults can stay active and healthy, continue to access the places they would like to go in the community, and not have to rely on getting behind the wheel. So you represent an organization called Elders in Action, and they've created an action plan for an age-friendly Portland, which is an awesome document that everybody should read because it's really phenomenal. It has a number of action items related to safe and healthy active transportation. And so along this same theme, I want to hear from you about how you and the organizations that you work for and with and the committees that you sit on ensure that the results of the transportation conversation and any transportation funding conversation benefit people of all ages and abilities.
Okay, well first, let me start with some statistics. Most of you probably know these. But every day for the next 15 years, an additional 10,000 baby boomers are going to turn 65. That means by 2030, we're going to have twice as many people over the age of 65 as we have today. AARP did a study a couple of years ago asking people where they would like to live when they grew older. And 88% said they would like to stay in their neighborhoods, if not their own home. However, half of them said if they couldn't drive, they would not be able to stay in those neighborhoods. A man who is 70 years old today is going to outlive his driving years by 6 years. A woman who is 70 today is going to outlive her driving years by 11. The AAP survey found that 61% of respondents over the age of 50 actually limit their driving time to certain hours of the day. 40% of the adults say they don't have adequate sidewalks, and over half said they did not feel safe crossing a street near their home. The Joint Center for Housing Studies at Harvard University just came out with a study, and out of the recipients that they surveyed, they found that only 16% of people over the age of 65 live within walking distance of a grocery store. So we're pretty sunk if we can't drive. In September 2013, the city of Portland did pass the action plan for age-friendly city, as Corey said. And transportation is one of 10 domains that is part of that. The transportation chapter includes improving system planning and investments, promoting active transportation for all ages, targeting community-based services, and implementing an education plan. Last week, I was at a gathering for transportation providers and professionals throughout the state, and one of the participants shared a story of an older couple that came up to him, and they said, you know, we've got this great, accessible, affordable home that we live in, and it's outside of the city, outside the city limits. They always thought that this is where they would spend the remainder of their lives, but they lacked viable transportation options, so they came to him for some advice. And he said he had a one-word answer for them: move. You know, that may be the most immediate solution for them, but I think it's the wrong answer. So back to Corey's question. How do we ensure that planning will be age-friendly for everyone? Well, I think we all have to be involved. It's not easy. When I started being a pedestrian advocate a number of years ago, I felt I was clearly out of my league. I didn't know the acronyms, I didn't know the players, I didn't know the organizations. This is not, transportation and planning was clearly not part of my education or my career. But I've raised my kids, I've taken care of my parents, and now, yes, I've got some aging complications of my own, but I think that it is my responsibility and my obligation to speak out, to not only advocate for my generation, but all those generations that are going to come after me. And it is not easy. When I testified at City Hall, I was scared to death. And that following, it was, the man in the toga. So. And then the town hall that came after that, remember that one? Yeah, did you forget? I remember. That was pretty raucous. There were hundreds of people there, and they were audibly and visibly angry about the possibility of a new tax or a new fee. They didn't appear to like bikers, and they hated speed bumps. So for me to get up in front of all these people and say, yes, I think the proposal could be different. It is not progressive. I think it needs to be changed. But we need these improvements. And I think, for what it's worth, they needed to hear me. That's my news. That's great.
Yeah. That was a great presentation. A lot of really good stories. I have to say one little anecdote and a question. For the rest of you too. My little anecdote is that as the Portland Freight Advisory Committee this week, and our freight group's been really positive on safety, though sometimes they get into that, put more money into maintenance sort of part of it as well. But why are we spending money on safe routes a little bit? But the group it was near the end of the meeting, and the group's like, what's going on? Congestion. And somebody's like, I think it's the start of school. Yeah. Which I thought was fun. Yes. But building off what you were saying, and what you said too, I remember was really moved or motivated, I guess, by you're saying that you got to do all those community conversations, and you're consistently hearing that traffic safety is this issue that's impacting people directly, and the issues are so complicated, especially like on 82nd, where we have different jurisdictions owning the facilities, and it's so hard for people that are, like me and you guys are out there trying to talk about funding conversations to sort of get that information right. I'm convinced that if we could figure out a way to, over a longer period of time, like parks has done, or schools have done, or others, to sort of keep a focus on this and solve some of these hard problems that can rely on like regional conversations, and federal conversations, local conversations. There's just a ton we could do and not to go off too much, the polling data, I mean, the public's, when we did polling on our streets effort, you know, the public is now valuing safety at the same level or a little higher than maintenance. And that's like for the last 14 years, I mean, that's a dramatic change. I think we should thank the people writing in the Oregonian these articles about equity and what's happening around that. But so in a certain sense, that we're leading on that, and we still have these meetings and other things where it's really complicated. We're having a hard time explaining that in this new effort, we'll spend more money in East Portland probably since annexation in a focused way around safety. I'm just sort of curious from the people around this table, do you have any advice for you know, people like me and others that are out there when we're trying to have these conversations about how we can do a better job of connecting the dots?
That's one of my follow-up questions. Is how do we make safety sellable? Like, how do we make it something that people want to buy?
You know, I think, yeah, there's not a one-size-fits-all message. I think when you're talking about safety, and I think that it's the same for so many different issues. I mean, you know, from safety to fluoride I'll talk about that. But anyways, like there's different messages that resonate with different communities, and you know, think about the Asian Pacific community. I think it's really about focusing more on like family and education. I don't think talking about like the active transportation why it's good for your health to walk and bike. I don't think that resonates as much as it would be really focusing on the family and education piece of it. So I think it's really, I think we're talking public cultural competency is extremely important for the more difficult to reach communities that maybe are most impacted but are the hardest to reach. Like I think it really requires a trusted messenger and a tailored message.
I was just going to respond to the
Oh, that was great.
One of the things that has been new to us, I'm a chairman for Rose City Park Neighborhood Association, and one of the things that I've been seeing being used is digital storytelling. So having that as a component of the public involvement, have the actual neighbors that are in the area talk about it and sell the safety or whatever it is with their stories. And I think that's the best way to reach the neighbors. One of the growing issues, and I know that Metro is dealing with this, is the public involvement piece and trying to get to people's homes and where they're reachable. And the level of public involvement is the rarefied folks that can come to these meetings, that can come to these workshops. And we're preaching to the choir. But there has to be better ways, both through the technology as well as, through our youth. They know how to communicate much better than we do, So, I don't know, maybe go to the schools and ask them how to do this better. But I'm constantly trying to figure out how to do that better at the local level, especially getting people involved in comprehensive planning. It's like people look at this document and going, I've done a website, I've asked people to participate. And just had a smattering, even though I am at a workshop for the Sandy Boulevard corridor. And it's like, man, getting people to participate is hard. And I'm always looking for better tools in the toolkit. So if you guys have any ideas.
It was discouraging in the comprehensive plan and the civic involvement to see that the percentage of people that give at least 50 hours a year of volunteer time is down. It's down less than 20%, right? That's what it is. So we're less involved now than we were, I guess.
And there's people like me that skew that, because I give, I donate about half my time. doing, good public involvement.
The rest of us are all stuck in traffic.
That's right.
There's actually studies.
Only with a text and drive.
Yeah.
Just kidding,
Anyway,
kidding.
but I'm open to ideas of how to do this better, and I'd like folks to talk about.
Well, Duncan mentioned Apano's work in sort of delivering these pedestrian safety messages to communities in the J District. I have you all guess how many Cantonese speakers we could get as a transportation bureau to a meeting to talk about pedestrian safety. It would not be 100. So, like leveraging the interest and the skill of community organizations is something I think we need to do a lot more of.
One thing though, in that, you need to make them feel important enough to want to participate.
Mm-hmm.
Just saying, we're gonna have a meeting and we preach to them about what you want and not see something for them, you're not gonna see them the next time.
Yeah. I'm looking forward to sort of debriefing with Duncan after this grant period is up. Yeah, I think I think sometimes we hold our messages and our what we're trying to get done too close as government agencies, and you can just see hearing about all of the community interest in traffic safety in the J District. Maybe there are better people to be carrying that conversation in the Transportation Bureau, and we just need to figure out how to.
And if I could actually talk about that process a bit, and Stanley was actually one of the trainers up there, so you can chime in too. But we worked with PBOT, and they used kind of this trainer-to-trainer model. So PBOT staff trained our bilingual folks, and then we went out to the community and the younger age. So I think that model really worked well because it was from a trusted source and it was in language. So it's just more effective than some government coming into the senior center and talking. And we also integrated a great digital story collection project with that as well. So this event that just happened on Tuesday, got a communications person there, and we captured 6 stories from seniors that were impacted by traffic safety issues, and they were really just excited to share that story. So I think the interest is out there in the community, and if you just give them the avenue to go to their space and let them have their voices expressed, I think that's a really powerful and empowering experience. And I think it better informs the civic process. And it's really hard for people to go to City Hall or the Metro and after and spend their time and leave work and not have childcare provided. Like civic engagement and input in the civic process is really difficult unless you're like a paid staff person. It's really tough.
All right, we've got 10 minutes left, so I want to just let Annie have a little bit of time to chime in some more. So the Metro.
That's how you ration my time. Is to
Remember, she called you lovely.